Hello, my friends. My name is Andy Falco Jimenez. I'm the author of the number one best-selling book, Today's CBD Oil, and it is the truth about this powerful ancient medicine in today's world. It is currently in pre-sale, and you can get it on Amazon. Just do a search for Today's CBD Oil, and you'll find it currently priced at 99 cents. So go ahead and get on there so that when it does go live, that you can have first access to that book. One thing that I have the good fortune of doing is traveling about, meeting people in the marketing space, the author space, and of course the CBD oil space. And I've run into a lot of very interesting people. Probably one of the most interesting people I've run into lately is Dr. Kaylea Boutwell. And I had the good opportunity to interview her the other day. And I thought I'd put this together to bring a couple highlights to our interview, especially in the beginning. What ends up getting lost towards the end is the stuff we talked about at the beginning. And so I want to come back to the beginning of our interview because it really does set the stage for what Kaylea had to share, Dr. Boutwell had to share in relation to her being a medically, classically trained surgeon who uses CBD oil in her practice to help her patients. And so I want to go back and into our interview and address some of the very specific and important points that were addressed early on in the beginning. In this first clip, I asked Dr. Boutwell to tell us about her practice, and I want you to specifically listen to what she has to say about opiates. And this is what she had to say.
Absolutely. So I graduated from my fellowship in 2009. And since that time, as you mentioned, my practice has been devoted exclusively to pain management, which means that I direct protocols for medications and also physical therapy. I do surgical interventions for pain management and, of course, manage the dreaded opiates.
Yep.
Which really solve no problems, create more problems than they solve for most of my patients. And so when something like this comes down the pike, I just hope that I don't lose the level of enthusiasm that I still have because it's still relatively new for us as well.
Yep.
And the fact that I just get rolling comments about how good these things are working for people, how well they're working for people. And I've actually used it myself and it's worked great for me also. So that's kind of how the flavor of my practice right now. My focus is on improving patients' function. So rather than giving them medications that trade their pain for either feeling sleepy all the time or not feeling like they're themselves or not feeling like participating in life, or just having a host of all the other problems that come with either being in pain or doing what you have to do to treat it, this has created quite a solution for us.
I really do love what she said there at the end about opioids, and it's something you really need to listen to. So next what I want to do is I want to make sure and set the stage and context for who Dr. Boutwell is and why her opinion is so valuable for you and the CBD world. So listen to this.
Absolutely right. I think that's a really important point because I am a traditionally trained interventional pain management physician, which means that, as my nephew was funny enough to say, I graduated from 28th grade. So that made me feel young, as you can imagine. But so, yeah, I mean, college, then medical school, then residency, then fellowship, and all of it was following that very traditional trajectory of Western medicine. So I was trained with mainly all of synthetic pharmacotherapeutics and the idea that we are basically illness doctors that respond to pain and problems as opposed to heading them off or as opposed to trying to actually improve the health of the tissues so that people feel better rather than understanding that people have pain and trying to find some way to cover that up. So okay. Absolutely traditionally trained and now open to this idea of working from the ground up.
So next, the obvious question is, so how did she find out about CBD oil? Where did it come into her radar, and where was this information coming from that caused her to give it a shot? Here's what she had to say.
All right. So when did CBD oil come into your view, into your radar?
My focus of awareness.
Yeah.
So really, I started opening my mental horizons when I had my own back injury. In 2011, I was on a rowing machine. Sure wish my injury had been sexier than that because there's a lot of cooler ways to get hurt. But I wasn't even rowing a boat. I was just in a gym, 6 o'clock in the morning, and ruptured 2 of my discs in my low back. So I went from being 32 to feeling 800 in about 5 seconds, and had to spend an entire year rehabbing my back. And the interesting thing was that even at that time, I felt like I had been changing lives for quite some time with the treatments that I was providing. But I didn't recognize, even through compassion, the fear that comes with hurting that way, and the uncertainty of, is this it? Is this my new normal?
Mm-hmm.
Am I going to be the person who has that surgery that only makes them worse, that I've been treating for years already? And so I think I just looked at the whole thing in a much more broad sense. So I brought in the tenets of nutrition, lifestyle, mindset, sleep hygiene, and a more natural approach to really getting better, and wondering if that injury wouldn't actually be a way not only for me to actually be better than I would have been in the long run, but if I could be a better doctor than I ever would have been, because I could relate to those patients on a whole other level. Right. So I brought in all those other facets, a much more comprehensive approach to care. And I started just listening to people who were like-minded. So I got into sort of the podcast threads of people, JJ Virgin, Dave Asprey, a big biohacker, bulletproof fan, mm-hmm. and was both literally and figuratively drinking the Kool-Aid, drinking the bulletproof coffee, so to speak. And so I think it was really through people like that who are actively living day by day to find better solutions for really big problems, mm-hmm. that I became aware of CBD oil.
So then you start taking it yourself. Is that correct?
I did, actually. So after I listened to a podcast that was actually about a 30-year Army veteran working at Walter Reed who had designed his own CBD oil as part of the standard protocol for treating military veterans who were coming back with PTSD and closed head injury. And all of them were having remarkable results, so remarkable that they were making a standard part of their treatment by using CBD oil as a key part of their plan and treatment. So I was very impressed by that and really decided to do a lot of deeper research, and obviously bought in several products, actually, and started using it for myself. And why that was important for me too, as you can imagine, is that, the days that I was describing to you before, if I'm in clinic, I'm face to face with a patient. Their well-being is up to me. I have to develop a comprehensive plan that's clear. I have to be concise and comprehensive with them, develop a plan for them that they believe and trust in and can move away with confidence. I can't be fuzzy-headed, which means I also can't have the type of back pain I can have because of my injury history, like my pain standing between me and being able to help them, or taking a medication that would blur me in some way either. And then the other days that I was talking about before would be in the operating room, right? And so clearly if I'm, putting harpoons in people's spines under x-ray guidance, it's not wise to do that when you might be off your game a little bit. So I needed something that would allow me that kind of pain relief, but being very, very clear.
So next, the obvious question is, what were the results for her in regard to using CBD oil for her condition? Like me, I wanted to know, did she have quick results? Was it something that she immediately noticed? Or, like others, did it take a very long period of time for the CBD oil to begin to take effect? I think this is an important question because many people have different results. As a matter of fact, some people have quick results, some people have results that come after a long period of time, and some people have no results at all. So this is really an important question I had for her, and let's listen to what she had to say.
So, for me, actually, it was a little bit more like most natural things happen, which is, like I tell a patient, if I tell you to go, to increase your level of exercise and you go to the gym, day A and day B might not look that much different from one another, but day A and day Z may look remarkably different. Right. And that's the way natural things happen. You start, using good nutrition, and again, day A and day B, but, a month later, you dropped 15 pounds, your skin looks clear, your eyes are brighter, you're sleeping better, you've got more energy. Yep. For me, that's how CBD oil was. So I needed to stick with it for a little bit, but it was well worth it. I have other patients, however, and I was happy to see you use the photographs because this is great. The example that you had was a patient of mine who was already using his CBD oil for his back pain. And he was one where a dose and 2 hours later, he had not only that sense of pain relief, but also kind of just comes with feeling like you had the spike take out of the back. And he started using it topically, which are the pictures that I shared with you, because it helped him heal, like I say, like a Wolverine.
Yep.
He traumatically amputated 3 of the fingers on his left hand. And 3 weeks later, the hand looks like the injuries were 3 years old. And I'm a surgeon. I know what that looks like. 3 weeks later, traumatic amputation with a table saw in a garage, and it's completely healed.
So that's great. We have a medically trained doctor, a classically trained doctor that can share an experience that she's had using CBD oil, which is fantastic. But now what I want to know is there a story that she can relate to us in relationship to a patient who used CBD oil to assist in whatever was going on with them? And of course she did. What I want to first let you know is that these pictures are graphic. And so if you get a little queasy when you see a little bit of blood or something like that, understand that these pictures show a little bit of blood, and the eventual the damage that's caused to this person's hand caused the amputation of 2 fingers because of the damage. And so I just want you to know that it's graphic. And so, but I'm going to let the pictures speak for themselves. And so you're not going to want to miss this. Even if you get a little queasy, it's worth watching. So here you go.
As I was telling you before too, I hope that I never stop being as impressed with it as I am just by starting to get used to the fact that it works so well. Sometimes you're like, oh yeah, it always works, and you lose an appreciation for something that's really a workhorse. There you go.
Yeah. So they're seeing the hand as it looked when it was first done. And so that picture was like immediately following. And of course, there's something showing up right there in the middle of it. There we go. That's pretty closely to after it was done, that first picture.
Yeah. So that was when he presented to the emergency department. And what you can see actually is that the tip of the thumb is cut off on the side closest to us. Mm-hmm. And then if you look really closely at the ring finger and the small finger, and by the way, his wedding ring was never found.
Oh, no.
The table saw cut straight through it, and they still haven't found his wedding ring. So if you can see at the base of that finger, the ring finger, like where his ring would have been, that's a cut tendon all clean through. And the vasculature, which provides, blood flow to that finger and the pinky, you can see that dusky, dark kind of gray appearance to the end of those fingers. Yep. Those fingers are not salvageable. So there would be no version of a repair of either the tendons or the blood vessels that could have saved those fingers. So this is actually one of the nicer pictures I sent you. It actually kind of put things back in their original anatomic ratios. Yep. Things were in different places before. Yeah.
Well, number one, I should have warned people that these pictures were coming. I'm sorry. Oh. As I did on the broadcast, but too late now. But I did mention in my broadcast when I showed these pictures for the first time is how interesting it is that you were able to replace the thumb, but have to remove the fingers.
Well, so they were able actually to reattach the tip of the thumb. Yep. It was kind of done as a flap. So that he had enough viable vasculature or blood flow to keep that part alive. But the other 2 fingers were a no-go. Yep. So next. So you can see the sutures. Yeah, sutures there at the tip of the thumb, and the kind of the wonky suture lines they had to make to try and just get the skin to come back together in a way that would heal in his ring finger and small finger.
How much after the event is this picture?
So that would have been right after it was sewn up. So they would have had to take him through surgery, complete the amputation of those 2 fingers, and close them with the suture.
So then we'll come down to this one here.
So this is about a week later.
A week?
Yeah, a week.
And he's 59, right?
And he's 59 years old.
Wow.
And yeah.
That is crazy. He's way older than me, but yeah.
Way older.
Yeah.
I assumed as much.
Right. All right. And we have this picture here. How long after the event is this?
So that's only about 3.5 weeks after the initial picture was taken. And you can see at this, what are called stumps. That also sounds like not a nice word, but that's, so at the edges where those incisions were are just completely healed. There's no acute, active, inflammatory appearance to that skin or tissues at all. And I actually saw him back in clinic about 3 days after that, which is where he gave me some more pictures. There you go. You can see it in that nice natural light.
Wow.
That's what an incision looks like months after an injury like that one, not
Wow.
weeks.
So let me go ahead and come back to my screen here really quick,
Okay.
and get rid of that so that we can see each other a little bit better. So one of the things I talked about in my broadcast, and of course, I'm not a doctor, because you could tell by the way I read your bio, is that I believe what the important thing about healing this quickly is that you'll have less opportunity to have infection, re-injury from bumping it and hurting it, getting dirt in it and that kind of stuff. So there's a really awesome, I guess, not side effect, but, result from having healing so fast and so good is that you don't have to have these long-term opening and stuff that can happen to it.
Right. That's a very meaningful benefit.
Yeah. And how about the pain? Was there any pain management because of the CBD oil, or just mostly for the healing process?
For this patient with this problem?
Yes.
Well, so actually, because it works so well for his back pain, and he uses it actually he has a tincture, and also has the transdermal. So he sort of works from the outside in and the inside out. And because it works so well for his pain there, he actually was using it on the hand for pain. It was actually just as you said, kind of a meaningful yet unexpected benefit that the healing was dramatically accelerated.
Wow. That is awesome. I when you showed me those pictures, I couldn't wait to share with everybody. And so thankful that he gave us permission to be able to use those.
Absolutely.
And share with people.
And one other application, just because I think it's a really relevant one, is that many of my patients come to me because they have something called diabetic polyneuropathy. There's another big word for you, which just means that these patients with chronic diabetes have nerve pain in many of the small nerves that are in their fingers and feet. It's called stocking glove neuropathy. And the thing is that not only they have discomfort with that I think could be meaningfully benefited with using the CBD oil, either internally or transdermally, but also they typically have difficulty healing both foot ulcers and other types of cuts and bruises because of the damage to their tissues by the glycosylation or that sugar coating of those nerves. So again, I think that would be a really an important thing for someone to recognize. And maybe if they or a loved one has pain due to diabetes or has difficulty healing injuries in their peripheries because of them, I think this might be a really interesting consideration.
Wow. Right. I mean, that is amazing. You took what would typically be about 3 years of healing and reduce it down to 3 weeks. And as we talked about, what the great thing is that it lessened the opportunity or the chance of infection setting in, of further damage being done by an open wound lasting longer than it really needed to. And so I think this was a fantastic example of the power of CBD oil. So to end this video, what I want to do is I wanted to ask Dr. Boutwell if there is a limit to the power of CBD oil. Is it only for minor injuries? What that last thing was not necessarily minor injury, but is there just a limit to what CBD oil can do for somebody? Or is it something that she's going to give to all of her patients regardless of whatever disease or damage or injury that somebody might have? And again, this is what she had to say.
So I have a friend here, Martin, who's on right now. He had a serious motorcycle accident where he broke and his feet and ankles and legs. I mean, it was a mess. And
what didn't he break? What didn't he break? One of the,
right.
Yeah.
Not a sense of humor, because he was cracking me up in the hospital. We were laughing.
Oh.
And so in your practice in regard to pain, is there some level of pain that you would not recommend CBD oil for, or do you kind of what is it when your decision making behind suggesting CBD oil? Because I mean he had so much damage to his legs. Would this be even benefited him at that time? Sure.
Well, I think that because I consider CBD to be so much more beneficial in so many ways, there's not a contraindication to it that I'm aware of in any way. Mm-hmm. So I would put CBD oil in really on a ground level. And then whatever pain it sort of didn't touch, maybe some type of breakthrough pain or surgical pain, something of that level, then maybe on top of that, you're adding one of the more, higher powered synthetic, the Schedule II opiate type medication. So, your hydrocodone, which is called Vicodin, or oxycodone, just Percocet, Oxycontin, any type of fentanyl, morphine, anything maybe that might be needed IV. Something that's very, very quick acting, very, very potent. but I would try to reserve those things, and always do, for that really acute setting. So maybe like, while you're in the hospital still and managed by people who can watch you for things like respiratory depression. And one of the problems with those medications is that people stop breathing. They also get GI gridlock. Their GI systems shut down completely. And you have to be able to have a really close eye on those things. And with the CBD oil, those things aren't problems. So if you have CBD oil, in my opinion, sort of feeding the meter first, and then you can come in behind that with any of the other, physical therapy and the more synthetic medications that are more targeted.
So I hope you enjoyed these little snippets from our interview. The interview was much longer. It was about an hour and about 10 minutes long. And so that interview is available on Facebook. I'm going to also make it available on YouTube and some other venues. So if you need access to that video, it is available. If you can't find it, make sure and private message me here in Facebook, and I will share that to you. Or if you're watching this on LinkedIn or Instagram or some other place, go to Facebook, look up Today's CBD Oil on Facebook. Send me a message that you need to see the entire interview between myself and Dr. Boutwell. And I think that you'll find that time you spend watching it will be well worthwhile. All right. So again, if you have not purchased my book, Today's CBD Oil, right now it's available for 99 cents because we are in pre-sale. It will be complete probably within the next 60 days. From whenever you're watching this, you may be watching this after the 60 days, so it is available now. Just do a search on Amazon and you'll find it in either form, pre-sale or published, and you'll be able to read the fantastic content that I'm planning to put on there, which includes my story, the story of others, and the truth about CBD oil. All right. So in either case, I will see you. If you have any questions, just make sure and contact me, and I will do my best to help you understand the power of CBD oil. All right. Take care, and I'll talk to you later. Bye-bye.